Hi, my name is Peter Frazer. Before I begin, I'd like to thank the Churchill Trust for allowing me the opportunity to be able to travel around the world and learn how the protection of those who are vulnerable on our roads and highways has been implemented in various countries. I was fortunate to be able to visit Sweden, Singapore, England, the United States, Canada, and New Zealand. My project was born out of the very real concern that our Australian society has placed mobility above improving safety outcomes for those who are vulnerable on our roads and highways. This bias that we have ensures that individuals, their families, their loved ones will suffer unnecessary injury and death in what are avoidable road crashes. However, various cities, states, and countries have implemented initiatives, behavioural change strategies, infrastructure programs, technologies, and legislation that they believe will improve outcomes for their citizens. So, this project allowed me to do a comparative analysis and to obtain an understanding of the costs and benefits of their policies and strategies, to also consider the cultural implementation issues and to assess where policies may assist us in improving road safety outcomes, assuming that the cultural difference is not so significant that they couldn't be pursued in the Australian context. The reason I'm involved in road safety is a personal one. Back on the 15th of February 2012, our daughter, Sarah Frazer, who was travelling to start university there in Wagga, was driving down the Hume Freeway. Unfortunately, that road hadn't been built to Australian specifications. Those standards weren't met because that emergency lane where she broke down was supposed to be 3 metres wide, but it had been built at 1.5 metres, which meant that her car was overhanging into 3 lanes of 110 kilometres per hour. There was a barrier beside where she broke down, which ran for 1,600 metres. On the other side of that barrier, there were brambles, and she couldn't physically get off that road. I was working for Roads and Maritime Services at the time. I was a manager, and I was in a manager's meeting for about 4 hours from 8:30 to 12:30 that day. When she broke down around 11 o'clock, she rang me, but my phone was off. When I got the voicemail when we exited that meeting, she was crying, and she's saying that I've broken down. I've rang the NRMA. Cars and trucks are passing just centimetres away. I'm afraid I will get killed here. I got that message at 12:30. My beautiful daughter at 12:32, along with the tow truck driver, the NRMA agent, who'd come to assist her, were both horrifically killed, leaving my beautiful daughter of 23 years of age, just starting out, in pieces on that Hume Freeway. I walked down into this very room that I'm sitting in now, and we've got 2 female police officers crying and my family screaming, and I dropped to the ground catatonic. I thought that this was going to be the worst day of my life, but it wasn't. The day after that, when we had to be taken down and carried in to the Goulburn morgue to identify our beautiful daughter, that was the worst day. It took about a month for me to be able to even talk, but we decided that we'd then start a group called Save Australian Roads and Highways, which is now just known Sarah. For the last 13 years, my life has been focused specifically on this. I'm really grateful to the Churchill Trust because they have allowed me then to look at what goes on in other countries. I've been able to understand some of the strategies that we're able to then push for implementation in Australia. There are many road safety advocates, non-government organisations, people who work within universities, professors. I'm hoping that this will not only be something that they'll reflect on, but it'll also be reflected on by individuals within our Australian community. Because at the end of the day, road safety is everyone's concern. and some of the learnings that I believe are already in play overseas. If we can implement those, we will make a difference in this space. Two fundamental principles that my work in road safety has been based on over the past 13 years. Firstly, we have to actively look after all those on the road ahead by choosing to drive so others survive. And secondly, everyone has a right to get home safe to their loved ones every day, no exceptions. The above was based on a Swedish road safety concept called Vision Zero. And so, as my first part of this research, was very fortunate to attend the Vision Zero International course in Gothenburg, Sweden. The Vision Zero International course with the Department of Traffic Care. It was over 5 days, and what that did is provide the most important framework for our understanding of what we need to do in the road safety space. In 1997, Vision Zero became an act of parliament, and so Sweden has led the world. The week-long course allowed us as participants to learn from global leaders in our efforts to explore and then push for innovative approaches to improve road safety in our own countries. Apart from meeting international colleagues and creating important relationships, the program allowed a comprehensive understanding of Vision Zero as a policy innovation, highlighting how it challenges traditional road safety practices. It offered important and practical insights into building a safer road transport system through progressive policy making, novel engineering solutions, changing behaviour through enforcement, understanding the physics of crashes on the human body, and hence the importance of pursuing strategies for speed reduction, and of course, public education initiatives to bring our community on board. Participants were engaged with those experts from the Swedish Transport Administration, as well as guest lecturers from government agencies, municipalities, academia, and industry. We were lucky because our program also included visits to Volvo cars and Volvo trucks, and an examination of Sweden's public transport system. Finally, a review of key infrastructure improvements that have made Sweden a leader in road safety globally. By the end of the course, we were each equipped with practical strategies to assess road infrastructure, regulations, and policies, and enable us to apply Vision Zero principles as we return to our home countries. It was a fantastic course, and it has become the foundation for all the work that I do in road safety every single day. Port of call was Singapore. And while I was there for a very short time, given the population density and Singapore's low fatality rate of 2.4 per 100,000, just over half of Australia's, I was looking forward to learning about why they had been so successful and whether there were any learnings that could be adopted in our urban centres. During my brief stay, I had the opportunity to meet with the Land Transport Authority, Singapore Police, and the Singapore Road Safety Council. I'd timed it fairly well, as the council invited me to their annual Road Safety Awards. That also allowed me to meet one of their keynote speakers, Mr. Luca Piscotto, Head of Road Safety and Global Advocacy for the Fédération Internationale de l'Automobile. The first thing that was clear is that their population density means that their road system is well maintained with clear signage. Indeed, it would have to be rated as 4 stars or better for the majority of their roads. It is also a pedestrian friendly place with overbridges and underpasses to protect their vulnerable road users. To minimise the need to get into private vehicles, they have a high frequency public transport system that reduces that reliance. And this is also supported by, firstly, a high cost of private vehicle ownership, coupled with road congestion pricing to disincentivise private vehicle travel. As a result of my meetings and simple street discussions with people, it would appear that as a culture, Singaporeans have a significant respect for authority, and I believe this contributes to their much higher level of compliance than we find in Australia. My next port of call was London, England, where I was fortunate to meet up with the United Kingdom Road Safety Foundation, the Towards Zero Foundation, as well as Transport for London. Interestingly, unlike Australia, England has had great success in driving its fatalities and serious injuries down, with its rate just above the best in the world. It was clear that the focus remains on improving road safety outcomes despite their good results. I also had the privilege of being able to attend the Highways United Kingdom conference in Birmingham, where I not only was able to meet up with experts in the field, but also those involved in road infrastructure and traffic management. It was a great opportunity. With regards to their low fatality rate, it appears that there's a number of factors which we can actually talk about. They have strict laws and enforcement programs, just as Singapore does. And the UK enforces these stringent traffic regulations and significant penalties for offences such as speeding and drink driving. They also have advanced road infrastructure, much better than we'd find in many parts of the world. Their roads are well maintained, there's clear signage, and effective traffic management systems contribute to that safer driving. And importantly, and harking back to the experience in Singapore, their public transport system is comprehensive, if not a little bit antiquated. That extensive network of transportation reduces the reliance on private vehicles directly, thereby decreasing both the issue for potential crashes and, of course, the other one. Literally, their traffic moves much better than ours does. One of the few things that really surprised me is that there is a lack of graduated licensing system, our P1 and P2 reds and green P plates, that they don't have that for novice drivers. Despite this, their figures are obviously so much better than what we experience in Australia, and their road fatalities are going down while ours are going in the opposite direction. My next port of call was the United States, and my focus would initially be New York City, as it has adopted the principles underlying my Vision Zero international course back in 2014. Indeed, that's when it became a Vision Zero city. In New York, I would both brief and meet up with New York City Council officers, including the then Deputy Chief Fleet Officer, Deputy Commissioner Kerman, Director of Safety Policy, the New York City Department of Transport Assistant Commissioner, and a meeting with the Executive Director, Mr. Brian Roos, National Association of City Transport Officials. There is no doubt that despite being a Vision Zero city, and in spite of the fact that there is a significant emphasis on providing outcomes, the substantial cultural differences between the locations I had previously visited and the United States of America, with its emphasis on personal freedoms, meant that compliance by the general population was a real limitation, and especially when seen in terms of the enforcement by the state and local police forces, this has become a real barrier to improving road safety outcomes. Having said that, New York City has specifically improved outcomes for its population by lowering the default speed limit from 30 miles per hour, which is 48 kilometres per hour, down to 25 miles per hour, which in Australia would be 40 kilometres per hour. It's expanded its automated speed cameras in schools and high-risk areas, and they now operate 24/7. There has been increased police enforcement targeting speeding and reckless driving. They have introduced protected bike lanes and pedestrian islands to reduce vehicle conflicts. They've expanded those bike lanes and the city bike program to encourage people to use active transport as opposed to using their vehicles. They've also, at fleet levels, required truck side guards so that we can prevent pedestrian cyclist fatalities. They've improved pedestrian crossings in high-risk areas. So New York City is committed to increasing Vision Zero outcomes by improving road design, strengthening enforcement, which includes reckless driving and drink driving, and in the end, promoting safer transportation. I would also visit Washington, D.C. to meet up with the Governors Highway Association, as well as then heading over to Virginia to catch up with Transurban US, a subsidiary of Transurban here in Australia. I had one of my most important road safety meetings during the whole of my visits overseas. But in terms of road safety, it was one of the most challenging cities that I've ever been to. But of course, there's always bright spots. So let me tell you about my meeting with Dr. Kenji Inaba. Dr. Inaba is a world-renowned trauma surgeon, professor, and law enforcement officer, uniquely blending medicine and public service. As a professor of surgery, anesthesia, and emergency medicine at the Keck School of Medicine at the University of Southern California, he is at the forefront of trauma care, specializing in emergency surgery and critical injury treatment, including, of course, from road crashes. His expertise has made him a leading figure in trauma research, and he publishes extensively on topics such as hemorrhagic control, resuscitation, and trauma system development. Beyond his medical career, though, Dr. Inaba serves as a volunteer police officer with the Los Angeles Police Department, dedicating one day a fortnight to active duty. This unique role allows him to bridge the gap between law enforcement and emergency medicine, providing first-hand insight into the critical moments following severe injuries, including, of course, with road trauma. His work with the LAPD enhances his ability to train officers in the field with life-saving medical technique and such as bleeding, control, and trauma response, ensuring first responders can provide immediate and effective care before patients reach the hospital. He also has a direct road safety focus and continues to promote safer outcomes within both the police and the general community. I was very fortunate to meet Dr. Inaba and spend some time with him and talk about his dual careers, which embody both that dedication to saving lives, both in the operating room and on the streets of Los Angeles. His work has not only advanced the field of trauma and surgery, but also strengthened the relationships with the medical and enforcement communities. And of course, in the road safety space, he's become an absolute key to the work done. His expertise, leadership, and hands-on commitment continues to make a profound impact on public safety. I was very fortunate to have an opportunity to meet with him. Having landed in the United States and recognizing that there's so much focus on the individual, you recognize that that actually creates circumstances at the level of policy, at the level of how we build our infrastructure, of what happens on the ground, because police forces aren't under just a state, but individual police forces. Like the best example for me was California Highway Patrol is dislocated from LAPD, so they don't react in the same way and they don't communicate in the same way. I think that's a problem. I also think that focus on the individual is a problem because as I've just come across from London and from Sweden and of course Singapore, where there tends to be much more, not so much reliance on authority, but acceptance of that things are being done for a better community outcome, just doesn't seem to be the way it is in the US. And I recognise that I was in two locations, not in the deep south, where that push against government is very, very strong. Arriving in Vancouver, Canada, felt very much like I was on my way home. Indeed, there appeared to be a substantial difference that immediately felt collegiate and, dare I say, polite upon arriving at Vancouver Airport. Of course, I'd just gone from a city where the single focus appeared to be the reliance on a motor vehicle to move its population, to getting on the SkyTrain from the airport into the city and then transiting by bus to my hotel, and all the time while filming. I was once again very privileged to have the opportunity to be able to meet with road safety experts, including, and by special mention, Professor Tarek Saeed from University of British Columbia, Megan Oakey, Provincial Manager for the Injury Prevention at the BC Centre for Disease Control, and the Watch Commander for BC Highway Patrol at Burnaby in Vancouver. Just very briefly about Professor Sayed. He's a distinguished researcher at UBC. He is a leading expert in road safety, traffic engineering, and transport systems. His work has significantly contributed to improving road infrastructure, crash prevention, and traffic management in Canada and beyond. His most influential contribution is the use of video-based traffic conflict analysis, which allows policy researchers to identify potential risks before they result in actual collisions. His research supports Vision Zero, which is fundamental to the work that we do. And one of his colleagues, Megan Oakey, who serves as the Provincial Manager for Injury Prevention at the BC Centre for Disease Control. She's been working in this area for the last 8 years, advancing public health initiatives across British Columbia and beyond. She has a special relationship with road safety, and I was very proud to be able to spend time with her as well. My last port of call before getting back in Australia was New Zealand, and I'd be travelling the North Island between Auckland and Wellington. I wanted to see what the roads were really like, and along the way, catch up with road safety experts. And I was very, very fortunate to have the opportunity to see what is a beautiful country, but with roads which are extraordinarily dangerous. One of the first things that strike you is that the majority of New Zealand roads have speed limits set much higher that would be reasonable in Australia. And it is very disappointing to recognise that the new New Zealand government has decided that it's going to raise the speed limits on the roads, which is going to put all those who are vulnerable on New Zealand roads and highways at greater risk. It's a basic physics issue. If you've got increased speed and increased crashes, you're going to have high impact forces, which of course means an increase in death and serious injury. I spoke to a number of road safety experts, including at the Future Roads conference in Hamilton, and without exception, there was significant trepidation, and those who are most vulnerable, including our road workers, are absolutely at risk. And sadly, with the road crash fatality rate about 50% higher than in Australia, it is anticipated that this will increase. This is a 100 km/h road. We just saw a temporary traffic management sign saying that we needed to slow down to 70 kilometres an hour. I'm currently doing 55 kilometres an hour, but it's no way 100. It's got nowhere to go off on the side. There are little embankments there. It's a narrow road, and if anyone was to cross over here we go. So here's another temporary traffic management sign. 70 kilometres an hour. I'm currently doing 57 kilometres an hour, and you can see we can go straight over the side there, down onto, I assume, just to a big embankment. Yeah, probably around 6-7 metres down, straight over the side, no protection. This is insane. I left the country feeling that there was little that would be taken from New Zealand and brought across to Australia that would help decrease our fatality and serious injury rates. Reflecting on my trip, it becomes very clear that with the exception of Sweden, and to a lesser extent Singapore and England, disappointingly there is little we can learn from the United States and certainly now New Zealand. But if we are smart, we can learn from the experiences of those first three countries. Firstly, we need to recognise that crashes will always occur, but what we need to do about it is to ensure that the impact forces are such that the individuals involved are not seriously injured, let alone killed. As 30 kilometres per hour has been set by those leading road safety governments and councils for our urban and suburban areas, we need to start doing the same in Australia to ensure that those roads that we all share with our young children, our cyclists, and our aged population are set at no more than 30 kilometres per hour. Secondly, we know that humans, by our very nature, are mistake-ridden. This is a fact of life. As such, building roads that are not forgiving when a person makes a mistake is much more likely to result in death and serious injury. We must therefore, firstly, stop blaming those who have been seriously injured or killed and ensure that our roads have safe runoffs and emergency lanes and barrier separation. Thirdly, when a crash does occur, reduction in speed is the best medicine we have to prevent serious injuries and fatalities. So travelling over the speed limit, we know what increases the chance of not only the driver or riders being killed, but the innocent bystanders as well. Lastly, we know that compliance and enforcement actions must go hand in hand if we are to change aberrant driver behaviour. This means camera systems to detect mobile phone use, non-seatbelt wearing, and when it comes to speed, if we want to change behaviour, we need to randomise enforcement and use average speed cameras in favour of just single point speed cameras. I look forward to this presentation being reviewed by researchers in the road safety space. But moreover, I'm hoping that it also spreads out to our community because with community support, our politicians get braver. And if they get braver, we can actually ensure that the points that I've made in terms of those recommendations are adopted. And once adopted, we've got a way of driving down the number of people who are killed and seriously injured on Australia's roads every single year. 1,300 was too much last year. We're supposed to be at 570 by the end of 2030. Let's commit to improving road safety. Let's get everyone home safe. And lastly, I want to thank my family for the support that they've given me over the course of many years when I've been in this space, but especially with my trips with Churchill. And the last thing I'd also like to say thank you specifically to my wife because she puts up with me spending so much time doing road safety stuff, and in this case, talking about my Churchill trip. Thanks again for the opportunity, and I look forward to having this spread throughout our community so we can ensure the safety of all those on the road.